passive euthanasia should be permitted in our country as well in certain situations. So this was the Supreme Court verdict. Now, but the good part was they said for the first time that yes, passive euthanasia is legal as long as safeguards are met. But they said such a decision requires approval from the High Court. So if you want to make such a decision, you actually have to make an appeal to the High Court. Now this is in the interest of the protection of the patient, protection of the doctors, relatives, friends, etc. Because there are other aspects of it. There might be people with vested interest, there might be people, caregivers who don't want to continue the care. So they said before making such a decision, you can't just go ahead and make it. You have to appeal to the High Court, and then you have to get permission to do so. Now the implication of this judgment is the unfortunate part, at least for doctors and ICU, what they have done is they have clubbed passive euthanasia with withholding and withdrawal of life in intensive care unit. Now, as you know, when you have a patient who's at home, who is a permanent vegetative state, that patient is alive and having a meaningless life. You cannot compare that patient in the ICU who's on 2 and 3 organ failure, who requires dialysis, and there's futile care. There's few hours or days to decide. You don't have time to go to a High Court and make an appeal that this patient's life is no longer this is futile. Please allow us to stop the ventilation or to give morphine and do this thing. So they have clubbed two things together. So the good thing that's come out of the verdict is for the first time passive euthanasia has become legal. Okay, so for the first time in India you can actually passively go ahead and give someone a comfortable end of their life. But at the same time, having clubbed these two things have made it very difficult for doctors in the intensive care unit. So all those practices which you could do very, very freely, we have to be very careful because now there are legal implications. So, as I mentioned, this declares that passive euthanasia is not unlawful. Procedure prescribed for passive euthanasia is not practical for us in the intensive care unit. It is well suited for permanent vegetative state who's at home, and you have good time to make a decision about this patient. You can appeal to the High Court and you can get a decision. So it will actually relieve the agony of a lot of families and also the patients who are just prolonged and having a futile existence. Now these families can appeal to the High Court and they can actually get permission for ending the lives of these patients. But public opinion, parliamentarians, etc., mobilization and all this is required. So what has happened is the Indian Society of Critical Care Medicine, we have actually appealed to the Supreme Court and we have said that these two things are totally different and they should not be clubbed because decisions in the ICU have to be expedited and we cannot have this kind of thing mixed together, though both are sort of passive euthanasia, because here also you are assisting the patient to end his life, and there also you are doing the same thing, but the context is totally different. Now I'd like to end, there was a lot of this legal discussion going on, and since my boss was also involved at Supreme Court, there was a lot of talk about all this, so we were all giving our opinions and taking opinions of different people to help him out, and I thought we still don't have a clear legal standing on it. And much after the verdict, I came across this, part of this Hippocratic, this thing from the Hippocratic Corpus, and if you read it, it's so clear and so simple. So Hippocrates says that first I will determine that what I conceive medicine to be. In general terms, it is to do away with the suffering of the sick, to lessen violence of their disease, and to refuse to treat those who are overmastered by their disease, realizing that in such cases medicine is powerless. So thousands of years ago, Hippocrates has already talked about, medicine cannot just be endlessly given. There are cases where it's futile, and I have to realize that, and in those cases I have to stop. So when I saw this later, I actually felt that, maybe, they should have just shown this to the Supreme Court, because it was just so simple and so beautifully written. So that's where we stand today. Thank you very much for your attention. So the process we follow is that, one is from whom it comes. Sometimes it is the family who starts the, like in this audit that we did, there were a lot of aspects. I didn't want to cover all this in the interest of time. The family approaches us, saying that doctor, another patient is 10-15 days on ventilator, he's not getting better, is he going to make it? Or often it is when they run out of the money, Initially they tell you, we want to do everything for the patient, do this, do that, and once the money starts getting over, they say, isn't this futile, we're spending so much money, we have to get back to our jobs. So often it is initiated by the family, and at that time we sort of, when the family starts talking about it, we take the opportunity to, that's a good time to start talking to the family about any type care practices. Or sometimes it is initiated by the intensivist itself. Of course, we make a decision. It's a joint team decision. It's not a decision made by one person, the registrar, consultant, and the primary service under whom. So, the surgeon tells us, we discuss with this. After we make a decision, we discuss with the surgeon, with the primary service, that, we think this is futile, and that he's got very advanced disease, or even not necessarily even cancer, even an acute refractory condition. He's an interstitial lung disease, advanced COPD, or that kind of terminally ill patient, not necessarily, or heart failure, very advanced kind of condition, futile. So we discuss it with the amongst ourselves, and then we talk to the family. Now we talk about two aspects. Either limiting. We decide whether we're talking about limiting or we're talking about withdrawing. Even if our decision would be to withdraw, we first start talking about limiting care. So we get a sense of the family. We discuss with them and we talk to them and we say, this is, going to be futile. Even if we continue, this patient is unlikely to survive. And then they ask us, what is the percentage? What is the chance? These are kind of questions that the family would like to know. And then we, sometimes one meeting itself is not enough. They say, no, doctor, please go, all out, and we don't want to make this decision. But sometimes we come back again and talk to them the next day. So in one sitting itself, sometimes it can't be done. Maybe there's one talk in the morning or in the evening, or the subsequent day, and then they are much more receptive once you've already talked to them and you have a rapport and relate, with them. And then they themselves go back, talk to their families. Sometimes you talk to them and they say, no, my Tauji will come from the village, or this one will come. Often there's a very paternalistic sort of this thing. People making this decision might not be the immediate son. It might be some uncle who's coming. So we do wait, and then they tell us that, next time it becomes much easier, and they go on to, limitation of care. So we start with limitation, and subsequently we talk to them about even withdrawing, And sometimes there is a family who says, oh, let him go peacefully, we don't want anything done, a ventilator bhi band karo, sab kuch band karo, usko aaram se jaane do. That makes it, that's very small number of patients, but that makes it much easier for us. But all this was very easy until the Aruna Shandbag got good, because after this, it actually, if you look at the legal context, earlier there was no legal stand, but now if you have to make a withdrawal, you actually have to go to High Court legally. So until we don't have a ruling for intensive care unit, it has become extremely difficult. But what we write on paper, we write do not escalate supports, and we write comfort measure only. And we completely stop with withholding practice, withdrawing practices. What we do is only limitation. So stop it. Withdrawing, we have completely stopped after this. But I'm sure in many centers across the country, all this is happening. We all know that this is futile and we shouldn't continue. But I hope, we'll have a Supreme Court verdict on it. We had actually, even the society had made a complete draft and everything, but the government of India had sort of rejected it, saying that no, this cannot be done. Of course, they have concerns that it will be misused and people will, properties, people trying to, this thing, and it's not in the best interest of the patient. But at some point, we have to draw the line, and we have to, talk about medical futility and not go on endlessly prolonging the lives of these patients. Yeah. Yeah. So there's active and passive. Passive is when you're actually going ahead and, like killing somebody, homicide.